All right, here's our anesthetic cart that we uniformly use throughout all three hospitals in the health region I work in. So as you can see, it's similar to the layout of many others. Has drawers organized by lines, drugs, airway, pump supplies, fluids. We can start with the sides of the machine. We got our sharps container right here. And we got a garbage sitting right beside it. On the side, we have a stethoscope and normally scissors and cryle. This is our not very often used room, so some stuff is missing. On the other side, we have easily accessible gloves. We have some hand sanitizer ready to go. You got tourniquets sitting on the side. We have these new rolly things, so you just pull one out as you go along. On the back of the cart here, you can see we have a bagger as our backup emergency ventilation oxygenation strategy. Inside here we have, literally you can see the list. We got suction catheters of various sizes. We got a bougie, an airway exchange catheter, some temperature probes, things that obviously don't fit inside. Coming back to the top here. And they're just organized on top with all your syringes, like your quick access and stuff you use frequently throughout cases and pretty much every case. There's arranged by size. We got all our different syringe sizes and just some variety of stuff on top, some gauze, some tape. Once you grab those throughout, you want them easily accessible. And then on top here, we have all of our drug stickers. So you can grab them very quickly, simply. You got the orange stickers for things that are on there for antibiotics, norepi, a few other things I think we don't have stickers for. Quick little swabs. We got all our blunts and just the little syringes, either for Lido or if you're drying up small amounts of drugs, 1 cc, more popular in peds. So getting to the top drawer. Top drawer, we always do drugs. I'll kind of like walk you through a little bit of them there. You can kind of see. We got all of our main stuff there. And then in the middle here, we have our emergency drugs. So mostly for more urgent stuff, pressure issues. So we have our Benadryl for anaphylaxis. We got Fennel and ephedrine for pressure and nitro for hypertensive crisis. Over here, we have our nitroglycerin. So if you have some possible MI or cardiac issues where you want to go on there, you got your Ventolin. We got our emergency epi, you can see, in case you have a code situation, a bunch of flushes, propofol. We try to stock as many as we can. It's used almost every case, and with the adults are the large doses. So going on to drawer number 2. Drawer number 2, you can see in the front is vascular access. So inside of here, we have a variety of cathetons for IVs, and we have a few tubes for blood work, and we have some hypodermic needles in the back for if you had to give like intramuscular or no IV situation going on there. And then on this side, we just have a few little things for putting in art lines, tegaderms, scalpel for emergencies, some blood gas syringes, just kind of adjuncts to securing your lines and so forth. On to drawer number 3. This is our intubation one. So on the side here, we have our OPAs. We have some rest-on foam and some oral bite blocks there. The McGill, some stylettes. We got some MPAs there. And then we have some Lido jelly. Normally have some Muco. I think it's just sitting on the anesthetic cart right now. Got a couple different handles, different blades. Normally more blades, but like I said, this cart's not used very often, so normally we have more 3 blades. On to the next drawer. This is labels tubes and LMAs. Very straightforward. We have a variety of sizes, 6, 7, 8, 9. More of the more popular sizes, you just go by use, right? Our LMAs, we use the uniques here in the disposable variety. So we have a 3, 4, and 5, a couple of each. And we have some evac tubes, not used very often, so just off to the side. And then next drawer. This one is labeled with all the pump, patient monitoring protection, So pump, we got all our big 60cc syringes. We do use a lot of TIVA pumps here. Some big propofols for running TIVA cases. We have some syringe anti-siphon tubing there, the same thing. And then some extra little adjuncts to everything. So we got some gastric tubes and some adjuncts to connect to there. A little gang of 3 for some different IVs for IVs. You got some goggles, prongs. We have some triples and doubles in there for IV access. And last drawer is all fluids and hanged. So we got a variety. We usually keep some ringers, some normal saline for mixing up drugs. Keep our inhaled anesthetics down there. And this one is labeled IV and accessories. So we got all the IVs over here. Keep mostly just primary lines and some blocks, but there's some secondary lines and micros and extensions for all your little extras. Overall, everything's fairly straightforward and similar to many other places. I find the fact that we keep it uniform everywhere makes it very straightforward. Once you're used to the system, and everything's kind of grouped with each other, so I find it works really well. If anything's different from other places, it's probably just of ease or what products we have. Yeah, that about covers it.